Today we are covering blood transfusion administration, a critical skill the NCLEX will absolutely test you on, primarily through safety and priority questions. Let's start with compatibility, the foundation of transfusion safety. The exam expects you to know that type O negative is the universal donor for packed red blood cells, and type AB positive is the universal recipient. A common question might describe a patient with type B negative blood needing an emergency transfusion and ask which blood type is safe to administer. You must know that only B negative or O negative blood can be given. The Rh factor is just as important. An Rh negative patient must never receive Rh positive blood. Before you even spike the bag, the verification process is your most important safety check. The NCLEX loves to test this step. It requires 2 licensed nurses to verify the patient's identity with their name and date of birth, the blood product, the blood type, and the expiration date, matching it all against the provider's order. An exam question might ask for the nurse's first action if they notice a discrepancy between the patient's wristband and the blood bag tag. The only correct answer is to stop the process immediately and contact the blood bank. Do not administer the blood. Once verified, administration protocols are key. You must use tubing with an inline filter and prime it with 0.9% normal saline only. Never use dextrose solutions, as they cause hemolysis. The exam will trap you on this. You will be asked which fluid to hang with blood, and normal saline is the only right answer. You must start the infusion slowly, typically no more than 2 milliliters per minute for the first 15 minutes. And you must stay with the patient during this time. This 15-minute window is when most severe reactions occur. A priority question will ask what the nurse should do immediately after starting a transfusion. The answer is to remain with the patient and monitor for signs of a reaction. Recognizing and responding to a transfusion reaction is the highest stakes part of this topic on the exam. The NCLEX will test your ability to differentiate reactions and act decisively. An acute hemolytic reaction is the most dangerous. Look for signs like fever, chills, severe low back pain, tachycardia, and hypotension. This is a medical emergency. A febrile non-hemolytic reaction is more common and presents with fever and chills, but lacks the severe back pain and hypotension. An allergic reaction can range from mild itching and hives to severe anaphylaxis with wheezing and respiratory distress. For any suspected reaction, the exam will ask for your first most immediate action. The answer is always the same. Stop the transfusion immediately. Do not slow it down, stop it completely. This is the #1 safety priority. To remember the critical first steps for any reaction, use the mnemonic: stop, saline, save. First, you stop the transfusion. Disconnect the blood tubing from the patient's IV catheter. Second, you connect a new bag of normal saline with new tubing to keep the IV line open. This is critical for administering emergency medications. Third, you save the blood bag and all the tubing and send it back to the blood bank for analysis. After these initial actions, you will assess your patient, take vital signs, and notify the provider. The NCLEX will present these as options, but the key to passing is knowing the absolute first step is to stop the infusion to prevent any further harm.